Hi, I'm Phaedra Kress, Executive Editor of the Aesthetic Surgery Journal, and I'm joined today by Dr. Simeon Wall Jr. Dr. Wall, thanks for being with us.
Yeah, thanks, Phaedra.
Could you tell us a little bit about two recent cases you've had, one that went well and one that had complications, and how you handled it?
Sure. So a lady that I did recently had had about 4 previous breast surgeries, and they had not gone very well, and she had what's called symastia, and basically her breast had dropped out, but also when she was in a bra, when they were pushed up, they came together, so it's kind of like a bread loaf across the center, as you can imagine. So that's kind of difficult. So I did a pretty extensive repair on that patient, and she needed a lot of work, and that was really extensive surgery that required some biologic materials and a lot of work on asymmetries, and she looks fantastic. And so for the first time in about 7 years, she's able to show cleavage and actually feel more womanly and feel like she has normal breasts. And so that was really satisfying. A case that I've also done pretty recently that didn't go so well. I have a lot of patients that come in from other places that are referred to me from other plastic surgeons, and I had a lady who unfortunately had a lot of laser liposuction from some from a non-plastic surgeon, and had a really unfortunate outcome. A lot of really burned skin, terrible big divots and contour deformities, and she came down. We did a pretty extensive surgery with a lot of fat grafting, fat shifting, a lot of liposuction, a lot of really pretty extensive work. And these patients really respond to surgery very variably, and they can have a lot of swelling, they can have more pain. These are patients that have a lot of scar tissue already, and we're reoperating on them, so it can be a problem. And this lady, the surgery went beautifully, and now about 2 weeks after surgery, she's getting a lot of swelling. So she's got a lot of edema of her ankles and her feet, and just like anyone who has a lot of swelling that we can imagine in some of our elderly patients, we've had to just tell her, hey, you've got to take a time out. You're not going to be able to be continuing to work like this. She's a nurse practitioner. You can't go to work, you can't see all those patients, you're going to have to stop, go home, get your legs elevated, and we've got to get this under control, otherwise you can compromise your results, and we would really worry about the long-term survival of her fat grafts. So that's been a little bit of a struggle, and these patients always are a little bit harder to handle, especially when they're coming in from a long way away and then they go back home and they're trying to get back to their regular activities. But we have some systems in place that have really allowed us to try to manage these patients a little bit better so that they don't feel like they're just left all alone.